Hi, this is Kathy Jakisik, editor of Healthcare Facilities Today. Thank you for attending today's webcast, Compliance Efficiency Through the Power of Technology. Our presenters today are Beth Edwards, Tony Martin, and Dennis Smith. Beth Edwards is an enterprise healthcare account manager at Dude Solutions, where she supports hospital systems with software solutions that increase efficiencies, improve service, and save money. She has more than 10 years of experience in healthcare and facilities management and is an industry thought leader speaking at national and local healthcare and engineering conferences, including ASHE. Troy Martin is a senior consultant at MSL Healthcare Partners with more than 30 years of experience in clinical engineering, security, environmental services, facilities management, plant operations, construction management, environment of care, and life safety. Prior to joining MSL, he has served as an Administrative Regional Director for Facility Services, a Director of Facility Services, and a Facility Manager. He's a former ASHE President and is also a Senior in the Society. Dennis Smith is a Senior Consultant at MSL Healthcare Partners and has more than 30 years of experience as a General Contractor and Director of Facilities. He has been actively involved in regulatory readiness with the Joint Commission, CMMS, OSHA, EPA, and a number of state and local jurisdictions. He's a long-standing member of ASHE and is a Senior in the Society also. He's also a retired Lieutenant Colonel of the Army National Guard. Today's learning objectives include: discuss what is driving the growing resources necessary to remain compliant, review the top compliance areas you should be focusing on, identify what your operations team should look for when contributing to compliance, and understand how to leverage technology to prepare for inspections more efficiently. Before we get started with the webcast, I'd like to cover a few details about today's event. A live question and answer session will follow today's presentation. To submit questions, please use the Q&A panel on the right-hand side of your screen and send your questions to all panelists. If you would like to direct your question to a specific presenter, please state the presenter's name in your question. Our presenters will answer as many questions as time permits. Today's event will also include a multiple-choice polling question. We ask that you participate in these polls, and your input is very much appreciated. At the conclusion of today's webcast, you will receive a link to download a PDF copy of today's presentation slides. You will also receive a link to a brief online assessment. Upon successful completion of this assessment, you will receive your CEU certificate. The webcast will also be archived at healthcarefacilitiestoday.com. And now, a brief word from our sponsor.
Dude Solutions, parent company of the Works Hub, is a leading provider of operations management software to healthcare organizations, from hospital systems to individual sites. We combine innovative, user-friendly technology with the world's smartest operations engine, empowering our clients to transform the most important places in our lives. Today, more than 1,000 healthcare organizations use the Dude's award-winning software to manage maintenance, assets, compliance, security, energy, IT, and more. For more information, please visit dudesolutions.com/healthcare.
And with that, I'll turn it over to Beth.
Thank you, Troy and Dennis, for joining us for this morning. This morning, we're going to start with the biggest barriers and the key elements to success to a strong compliance program. We're going to focus on the Joint Commission's top hospital compliance citations for the first half of 2017. This was published in the September issue of the Joint Commission's Perspective. Troy and Dennis are going to share their field experience relative to these issues, and then we'll provide some ways that you can leverage technology to improve your compliance program. So, starting with the complex hospital environment, there are several barriers to success. SAI Global 2017 Healthcare Compliance Benchmark Study identified the largest barriers being cultural acceptance of compliance, getting buy-in from the C-suite, having a strong disciplinary plan or consequences for noncompliance, having limited resources, especially a limited budget, and the influence of the leadership team. So now focusing on the key elements of an effective compliance program, and this was published in Converge Point in 2017. Those are having documented policies and procedures, a compliance officer and committee, training and education, open lines of communication, well-known consequences for noncompliance, internal auditing, and having a documented corrective actions plan. And I want to draw your attention to the fact that of all the above, they're all related in some way, shape, or form to communication. And in our industry, we know effective communication, it's a matter of life safety, and we need to leverage all the resources at our disposal and become as effective and efficient as possible. And that's where technology comes in. So let's move on to how we can leverage technology to meet your compliance needs. So as I mentioned before, in September of 2017, the Joint Commission published the top 10 citations for hospitals. We're going to go through each one of those and then talk about what the field experience is for both Troy and Dennis, and then also identify areas where we can leverage technology. So the top citation, number one, was LS020135. 86% of the hospitals surveyed by Joint Commission were cited for this. And that's that the hospital provides and maintains the systems for extinguishing fires. Now, this focuses on your staff's knowledge, but it also focuses on having your equipment inspected and ready for operation. Portable fire extinguishers, as well as assuring your automatic sprinkler systems, they're not impeded in any way, such as the 18-inch sprinkler clearance rule, that there's no corrosion, no paint, no hanging objects, et cetera. So let's start with you, Troy. Can you share with us what's your experience in this area?
Well, the 18-inch rule kind of goes across the plane of the building. The plane of the room, and by that, you know, the perimeter is okay to go up as long as it's go up to the ceiling, as long as it's not within 18 inches of a sprinkler head. However, where I'm seeing is like in the pharmacy, and in pharmacy, like when they have modular furniture, that the walls of the modular furniture will impede upon that 18-inch line. So, and then also where you have you know, central stores and storage in a room as well.
Okay, Dennis.
Well, I see these same things all the time when I'm in hospitals, and I don't know how many inspections Troy does a year, but I'm probably between 15 and 20 different hospitals during a given year. And so, you know, these are the sort of things we've been seeing forever, and I'm still finding object support on sprinkler piping. Now, you know, there's potential for that to be quantified, where that may give some relief on a single wire or something going across the sprinkler pipe. But typically what we see is low voltage wiring that's been installed outside of or separate from the facilities department, and which causes problems not only here, but we'll talk about something in a later slide. And, you know, I've thought that one possible solution goes back to those hexagons that we saw earlier in the slide, but, you know, the obstacles to success, and how important it is to create a cross-functional team if the culture allows in a hospital, so that facilities and other departments that are above the ceilings all the time can work together.
Okay. Great point. So technology, where can you tie that into this? So when you're tracking any of your inspections, any of your life safety assets, do those through a CMMS system. Ideally, if you have portable technology and you can scan a barcode, if you're doing some rounding, you see an issue, you can take a picture of it and create a work order right there on site. So that can be addressed urgently. Also, you can link your assets to any of the citations or codes, K-tags. Also for construction or maintenance, if any of the assets that are involved in that construction or maintenance is going to take place, you can force that an interim life safety measure documentation is completed, that it's reviewed by your safety team prior to any work orders or construction approvals being released. So the number 2 citation was LS020130, where 74% of the hospitals were cited. And this is providing and maintaining building features to protect individuals from the hazards of fire and smoke. So this is focusing on protecting your occupants from smoke, heat, fire through a system of building components that are your smoke barrier. And this system of components includes walls, floors, doors, your door latches, smoke dampers, managed penetrations in hazardous areas. So, Dennis, you want to start with you on this one. What are you finding out in the field?
Well, I still see that doors are a really big problem. Now, it's been clarified recently with Joint Commission that fire doors are require an annual inspection, but corridor doors shouldn't be ignored at that point in time. You know, it's important that they are able to close and latch, or at least stay closed. If there's an event where you need to close the room off for smoke. So one thing that I've seen that I would advise the audience to pay particular attention to, although they possibly are not a fire or smoke door, and those are doors exiting suites, which if they're not a fire or smoke door, they are a corridor door, but those are a good place for Joint Commission and for life safety inspectors to go take a look. Any door exiting a suite, make sure it closes, make sure it meets the criteria for a corridor door. It's also handy to include those, even though there's no requirement from Joint Commission, but to include key doors in your computerized maintenance management system so that you do periodically check them. Smoke damper inventory, I'm always surprised by how not well inventories are managed. And if there's a smoke damper that is not checked, how frequently it may be 30 days before the inspection company gets back to the facilities department and says, oh, by the way, you've got a damper that doesn't operate properly. So I think that is an opportunity to use a computerized maintenance management system better, to get a good inventory of smoke dampers, and to make sure that problems are not walked past or ignored during the period of time they're discovered until they're corrected.
Okay. Troy, anything to add with that?
No, Dennis covered that pretty well. Just make sure that your doors are inventory, that you have an inventory of the doors. So.
Okay, so one of the technologies that is really that will address that is to barcode your assets. Use a unique alphanumeric identifier for each asset where you barcode them. That way, when you're going through your inspections, you can check off each one that's been inspected. At the end, you can look at your report and make sure that nothing's been missed. This is another time where you can link an applicable code or standard to the asset. And I also advise that you include instructions to assets that are being inspected. So what am I looking for? And why am I doing this are always good to have on the parameters. You can do preset reporting, That way, when that document, Joint Commission comes in and they request certain documentation, these parameters are already set up and you can produce that report. Again, you can link your life safety code to these assets. And then also repeating again about making the ILSM form mandatory if you're doing any construction of assets. Number 3 citation was ECO 20501. This one was cited at 73%, and this is where the hospital manages risk associated with the environment of care. We're going to look at a couple of the EPs on this in particular, starting with EP 9, which is that it's clearly defined how the utility system should be labeled and that access to shutoff valves and breakers are only accessible to authorized personnel. Now, Dennis, I know that you've had a lot of experience in this area.
You know, when Joint Commission shows up today, the first place they go before they start a record review is to the fire panel in the hospital, and they want to see if the fire panel is in trouble, if you know it's in trouble, and what issues you're dealing with. But they also want to see what electrical panel serves the fire panel, and that should be labeled right on the fire panel so you know where to go look. And then you go to that electrical panel, the Joint Commission inspector will go to that electrical panel and look to see that the breaker for the fire panel is labeled in red, and that for construction after 1983, there is a dedicated panel to life safety, and it doesn't have any other non-life safety circuits in it. So when that happens, that's the first opportunity to look at an electrical panel and to see if the directory is complete. Are the breakers all labeled, or the directory shows where the breakers go? And during the process of the building tour, a number of electrical panels be looked at just to make sure that it's clearly defined so they can be shut down quickly. You know what's on the other end of a breaker. And that's true for other utilities in the building as well, Beth.
Troy, I think you said the same thing, that you come across a lot of facilities where the breakers aren't labeled.
That's correct. Well, not so much labeled as that the register on the you register on your electrical panel is not correct or updated, and so that's a real common finding.
And I think you also have experience, Troy, in these next two EPs that we're going to focus on, which is EP 15 and 16. Regarding ventilation, air balancing, and filtration, and critical access and non-critical areas.
Right. The EP15, which is the one that maintains ventilation and air balancing and filtration in critical areas, I'm finding less and less findings when I go out to do mock surveys. But the real area is that in EP16 is that in your support areas, such as storage areas and whatnot, that this is where I'm finding the incorrect pressures with that. So that's kind of EP16 is the one that really I'm finding more issues with than EP15.
Okay. So, technology tie-ins for this, again, you can use a computerized maintenance management system, mobile device to monitor all of these rooms, also to do testing and inspection. Another great idea is color coding the rooms. If you have on your mapping, floor plan, which rooms need to be positive, which rooms need to be tagged negative, which ones are critical access areas, which ones aren't, it gives you a good visual of how all this is interconnected and where issues can come in. Again, you can link the applicable code or standard to the room. I want to also point out that in regards to monitoring these rooms, doing them on mobile devices, even non-facilities maintenance personnel can put in readings. So if you have other personnel that are checking the rooms, that can be utilized. Don't restrict it just to the facilities maintenance staff. And then you can use an electronic capital planner. Now, I really like this feature because so many times capital equipment reaches the end of its useful life. Maybe you have a critical failure and the executive team wants to know, why didn't we know about this? So you set up a process that the leadership team agrees to. We want to be notified, 1 year in advance prior to the useful life, end of the useful life, or whatever that might be. That way, your system automatically notifies that leadership team this asset is reaching the end of its useful life, and everybody's fully aware of the situation. So number 4 is yes, sir, Dennis.
Yeah, Beth, Dennis here. Just real quick before you move on, elements of performance 15 and 16 are probably the closest way that a facility manager can get involved in infection control and keeping patients and staff safe by maintaining these air balances. So of all the things we do out there, there are a lot of important things, but this is one that may tie back to hospital-acquired infections the closest.
That's a very good point. Moving on to IC 020201, where 70% of the hospitals were cited. This is where the hospital reduces the risk of infections associated with medical equipment, devices, and supplies. So this is floor or walls, doors damaged in ORs or other sterile environments. A lot of times where dirty supplies or equipment is stored with new equipment, and also goes back to the air relationship. So, Troy, what are you finding out there in regards to this?
Well, with really with the like we're saying with the floors and walls and damage, is you're also looking for chipped formica within OR rooms, sterile prep areas, having chipped furniture with the formica or whatever. So really that's the slide covers it really well with with typically what we're finding out on the surveys.
Dennis, do you have anything to add to that?
Well, I think that one consideration is to make an OR and similar type rooms like that as an actual asset, just like you would a piece of equipment in the building, so you can periodically go in and whatever that periodic is, if it's every year or 6 months or 2 years, and inspect it for just this type of item. It's an infection control item, but it's really a facilities item as well to correct. And then to tie it back into that capital planner that you just mentioned a few minutes ago would be a perfect tool so that you can get some fairly real-time estimates of the liabilities that are out there.
Those are great ideas. Thank you very much, Dennis and Troy. Yes, again, this is a great time where mobile technology is going to come in, especially when you're doing your rounding and you can immediately report issues. Dennis had a great idea where you actually make those rooms an asset. That way everything can be tracked and reported through your CMMS system as well as for capital planning. So the next is number 5. It's EC020601, where 68% of the hospitals were cited. And this is where the hospital establishes and maintains a safe and functional environment. And we're finding a lot in regards to medical gas handling and storage specifically. Troy, you want to tell us what you're finding out in the field in regards to that?
Yeah, especially in 2018, there in the EC 020509, there are 7 new EPs that kind of reflect upon med gas. so and their storage. So, and one of those is they've revised the handling and storage policy and procedure requirements that the hospitals need to be made aware of, and so I really encourage them to look at the at that EC 020509 and to get acquainted with those 7 new EPs. There's the first 6 are brand new, and then there's a 7th one in there as well. So.
Okay, Dennis, how about you? What are you finding out there?
Well, you know, these oxygen storage rooms are typically the responsibility of some other department, maybe respiratory therapy. Respiratory therapy will come down and leave empties and retrieve full bottles and take them up on the floors. But I'm kind of surprised by how often I walk into one of these rooms and they're not clean. And you're taking an E-cylinder from a room that may be dusty or has some trash accumulation, and you're taking it up on a patient floor. And I think that's is not a good practice. And I think it goes back to creating a little cross-functional team between facilities and respiratory or whoever manages that particular inventory in the room. And then, if possible, and if the other department agrees to it, set up a regular PM that goes out to one of their staff to see that room is cleaned properly. And that way you can just do a scheduled reminder periodically on that. And then, of course, the facility side of it is to make sure that the room has a proper air change relationship, so that you have the high and low supply and returns, and that the electrical switches are above a certain height. So,
what are either of you finding in regards to bulk storage? Are there any issues out there with that?
Well, the new signage requirements, you need to pay particular attention to those. They are very specific. So bulk storage, whether it's the medical gases or it's other gases as well, excuse me, whether it's oxygen or other medical gases, they have 2 specific signage requirements for each of those rooms that you need to pay particular attention to. And just kind of a side note, I typically, in my findings, I'll be up over 30 findings for environment of care. Some of the stuff is very easy, keeping the room clean, making sure the sign's correct. And in the new for matrix age, that's probably about, you may see that from Joint Commission too, and if you're not used to those type of numbers out there, it's uncomfortable. So if you can get the easy ones off the list as soon as possible, it helps everybody.
Yeah, also, Beth, I'd like to introduce that in the cylinder room, where you're storing your cylinders, one of the new EPs, EC 020509 EP6, that it addresses the partial and in-use e-tanks and whatnot. So people should really kind of pay attention to that EP as well.
Thank you. Thank you for adding that. So technology tie-ins, again, as Dennis mentioned about, some of these things are simple things that you can check off, but they just kind of get lost in the cracks. So scheduling recurring tasks, automated PM work orders, and digital record keeping. This is, again, a great area where you can use a mobile device. You're doing rounding, you find an issue, you can quickly report that and escalate a work order. Tying your work orders to ISLM. And then, schedule and track the inspections, do mock audits, and also, include some of these areas in your rounding. So number 6 is LS 020110, 68% of hospitals cited. This goes to building fire protection features that are designed to maintain and minimize the effects of fire, smoke, and heat. And the goal behind this standard is to protect occupants from fire, heat, and smoke. And fire protection in this system is made up of components of walls, floors, doors, fire windows, fire dampers, and managed penetration. So Troy, I'll start with you on this. What are you finding out there?
Well, it's a typical, typically what I'm finding is facilities that don't have a good above-the-ceiling access program tend to have the most issues with penetrations. There has been a huge improvement in this area, but penetrations are still some of the easy finds out there. Propping doors open, doors that have automatic closures that have been either disconnected or they're broken and they don't latch all the way. You know, these are the typical things that I'm finding when I'm out and about.
Dennis, how about you?
Well, I tell you, one of the things that kind of comes as a surprise to folks when we're out doing the inspections is discovering a storage room that nobody knew was a storage room. So at some point in time over the past months or year or whatever that time period was, the function of a room changed. And if it's now a storage room, then it has to meet the hazardous room criteria, and the door has to close and latch, and the ceiling and walls have to be constructed properly. So that's something to be on the lookout for. Has somebody changed the use of a room within a building over the past year or whatever that time period is? The other thing that I find on a real regular basis is modified hardware on fire doors, and that's where a drop bar was removed from a push bar because new flooring was installed, and the latch portion on the floors were taken out and covered over. So you need to pay particular attention to that. That should show up in your annual fire door inspections.
So technology ties into that, again, using your mobile device and linking your CMMS. Again, still requiring an ILSM if there's changes, especially as Dennis mentioned, to those doors or any part of the system. Linking those assets to the life safety code. And again, if there's construction or maintenance that's going to take place that involves those assets, such as the replacing of the floor, the altering of the door, an ILSM is required to be completed. It's queued up, and the work order and construction approvals cannot go through until that has been completed and approved. So number 7 is EC 020201, 62% of hospitals were cited, and that in reference to the hospital managing risk related to hazardous materials and waste. So Dennis, let's start with you. What are you finding out there in regards to this?
Well, a lot of times I find on a rooftop inspection that exhaust fans serving hazardous areas, isolation rooms, laboratories, and that sort of thing, are either have been marked in the past, but the markings are faded. You can't see a biohazard sticker anymore. They need to be marked so that from any direction that you approach them, you'll understand that you have a hazardous exhaust. The other thing that I've found, and it kind of goes along with the room changes, is from time to time, some department or another may bring a new chemical in, or they may stop using a chemical, and those will trigger a review or a risk analysis to see if a eyewash station is required. And conversely, if something's not used anymore, if they no longer pour formalin in the ORs, is there still a requirement for eyewash? And so those things I see are the the management of the eye wash in the aspect of, do we really need it, or have we started using something new that now requires it that we didn't use previously? So those are things that are hot areas to look at. Beth.
Thank you, Dennis. Troy, what are you finding out there?
Well, to add on to Dennis's eye wash, typically when an organization has their clinical areas or the areas that have the eye wash located in them, leave it up to the staff to do the weekly checks. Typically, there's a gap in the logging of the weekly tests. Moving on to the master inventory for hazardous chemicals, that's I think it's in the top 5 findings now. And basically what that is that you have to have a master inventory of all your hazardous chemicals in your facility, and it's not, a lot of people confuse that with their SDSs, which is not an inventory. It's a good, the SDSs are a good template for tracking down and listing your inventory of hazardous chemicals, but it is not the master inventory.
Thank you, Troy.
Hey, Beth.
Yes, Dennis.
Just one more comment about Troy's absolutely right that facilities oftentimes doesn't even check the eye wash, but people get sick, people go on vacation, even within facilities or in other departments. And I've seen instances where a key person left, was out on medical leave for a period of time, and the eye wash didn't get checked. Or in facilities, the emergency lighting in the task lighting and generator didn't get checked. So by not having those within a computerized maintenance management system that can ping somebody to do that on whatever periodic basis it is required, and if those folks don't respond, to escalate it to another person and continue to do so until you get a result back. You just open yourself up. Like I say, I find 30 findings, 30 elements of performance out there, and sometimes multiple under each one of those. And a lot of them are some people just got sick and didn't check it for a week. So that's a consideration.
Absolutely, and again, you know, that can be an automatic process where if one of your technicians is on leave and they're responsible for one of these critical issues, that automatically can roll over to someone else, so it doesn't get lost in the cracks and not get inspected. Also, you know, you can make as part of your annual rounding that you review the master inventory that Troy mentioned. And again, this is where you can use mobile devices to do those inspections of things such as your scheduled eye wash. So number 8 is LS020120. 60% of the hospitals were cited. The hospital maintains the integrity of the means of egress. And this focuses on standards around the widths of the door, the corridor aisles, door locking, door swings, horizontal exits, the exit discharge, and also stair doors. Troy, what are you finding out there with this?
Well, this one is always, I think this is one that caused George Mills to pull his hair out a lot, is that because it's such a common common finding, and you know, most of that is the hospitals just aren't designed for the amount of equipment that's being used now, the existing hospitals. So there's just not a lot of storage space left for the organizations to store things. So basically, wherever you go, you still kind of find these cluttered corridors and whatnot. So.
Absolutely. Dennis, how about you?
Well, you know, going back to the doors, of course you should have an annual program for your fire doors inspections, and that's where the drop bars and stuff will be found. But there are doors that are more complicated, and they tend to be in locked units like a behavioral health or a mother-baby unit or something that require special releasing devices in addition to the typical fire door hardware. Those are the ones that need to be paid particular attention to, and make sure that they're on your inventory of doors and your computerized maintenance management system. And you may want to inspect them more frequently to make certain that the sensing devices that sense you from approaching from the inside of a unit will release the device, or that the timing is correct for the delayed release and that sort of thing.
Yeah, this is an area. There's some interesting things that you can do here. One is that you know, as your staff is walking the floor, if they see an instance where an egress is being obstructed, quite possibly, you know, by clinical staff, they can use their mobile device to take a picture and send that out. And then you can look at your reporting, and if you see that there are multiple infractions in a particular area, well, one, when there is an infraction, you can instantly send that to, you know, the safety committee and the appropriate personnel that are responsible for that area of the hospital. Then when there is repeated infractions, you can also set your device up so that, you know, when you're looking at your reports, you say, okay, wait, this is a space management issue. Let's look at our mapping technology, and let's identify, you know, how we can restructure or add additional storage space. So number 9 is EC 02-0505, and that is at 60%. And for this one, the hospital inspects, tests, and maintains utility systems. And we're looking at specifically EP 4 through 6. Troy, you want to start with this one?
Sure. The thing that I would like to point out here is that in the is with making sure that you've identified, you've done a risk assessment, and that you've identified your equipment that needs to be on alternate on the AEM, on the alternate equipment maintenance program, and of course your OEM. My simple rule for that is that if it's under contract, it's OEM. If it's not under contract, then it's alternate and it's AEM. So that's kind of the rule that I go by there. Also, in the new Joint Commission and CMS emergency management requirements is that the facilities are required to do a risk assessment in making sure that they can maintain temperatures, pressures, and humidity that they have enough alternate energy sources, i.e. emergency power, to be able to maintain the temperatures, pressures, and humidity throughout the building when they're in an emergency situation.
Dennis, how about you?
Well, I think that one of the key elements here is you have to be 100% on your PMs. And that has to be a real percentage. You know, you need to make darn sure that your PMing equipment, it may mean that you have to go back to your AEM, your alternative equipment maintenance system, and you can choose, if you can back it up with data, that you might extend the PM period, or that you might choose to run something to fail and take it off of that PM list. But there's no wiggle room anymore. It's 100%, and it takes very close management to make sure that happens.
Absolutely. So again, technology tie-in. These are recurring tasks that you want to set up. You want automated PM and work orders. You want digital record keeping. You want to be able to report on this. very quickly, very easily reach that data. And that way you can maintain the environment 100% of the time. This is also an area, I think, Dennis, you mentioned this in a discussion we had recently in regards to how you can, look at where your man hours are being spent. If the inspections are, if you're not having issues, do you want to share that with the group?
Sure. Yeah, one of the things before I retired as the National Director of Facilities at Catholic Health that we really concentrated on, Troy and I and the rest of the group, we wanted to know how much time was involved in maintaining a facility, because it happens periodically that there's a call to go out to reduce staffing. So if you don't have the hours captured for PMs, you'll never know what your fixed, and I'm going to call those fixed cost for a facility is you have to do the PMs and you have to be 100%. So every PM should have a number of minutes, hours, or whatever that is attached to it. And then in one instance, we actually created a coordinator position and assigned hours to work orders that went out. And using that data, when the RIF, reduction in force, came, we were able to say, okay, if we lose this person, we have to outsource that work, and here's what it's going to cost. So I think tying labor, excuse me, tying labor into a computerized maintenance management system is critical in this day and age to help you manage your assets.
And in particular, it needs to be simple. You want to have the capability to walk up to doing a PM on an asset, being able to hit a start button that starts tracking those hours, and then just being able to close it out, hit an end button, and easily track that kind of data. It has to again, use technology to make these things as simple as possible with all the limited resources that you have. Now number 10 was actually an RC010101, where the hospital maintains complete and accurate medical records for each individual patient. So since that's not facilities related, we're not going to cover that one at this time. I do want to share with you just a little bit about the Works Hub here before we close out and go to polling and then the questions. The Works Hub, what we try to do is use a cloud-based technology. We've got mobile capability. And, the key is that it was built specifically for the healthcare industry. Pulling from resources like Dennis and Troy that, provide all their wealth of knowledge and experience to maintain your compliance programs and actually leverage the system to help you do that. We're supporting hundreds of healthcare organizations across the country, doing things like corrective and planned maintenance, the barcoding, asset management, risk assessment, PO and inventory capability, capital planning, and very robust reporting. And again, in compliance related around your mock surveys and using it for rounding. So with that, I'll turn it back over to Healthcare Facilities Today, to their team, to launch a quick poll question and get us moved on to the Q&A.
Thanks a lot, Beth. This has been really, really helpful and informative. We appreciate your team's contributions to the webcast today. I'd like everyone to take a look to the right hand of their screen where you'll see a polling window open up shortly, and there it is. I'd like you to take a moment and select any or all of the options that best suit your information needs today. Here's the polling question we'd like participation in. The interest that you have today, let's find out. I'm interested in A, more information on the Works Hub, B, a private demonstration of the Works Hub, C, pricing information on the Works Hub, D, additional compliance resources, or E, more information on MSL Healthcare Partners. Now again, you can select any that apply to you today, so we'll step away for just a moment, allow you to complete the poll, and be back with you shortly. All right, we're just finishing up that poll, so please, if you haven't selected an option yet, please do so now. And as you are completing the poll, please remember that once that poll window closes, you'll want to open up your Q&A window again. Any questions that you've got for today's panel can be asked through that Q&A window. Please go ahead, type in any questions you have, and make sure you select all panelists when sending in your question. Well, I think we're done with the poll. I'm going to hand it back to Kathy at healthcarefacilitiestoday.com, and she and Beth will start our Q&A session.
Thanks, Wendy. We do have a couple questions already, and whichever panelist thinks they can take care of this, please just jump in. First, on the hazardous material master list, does this require a quantitative amount and location within the facility?
This is Troy, and you should get a PAR level to begin with, and so yes, you should get the PAR level. Work with your materials management to see. But also, what I would recommend is that if you have a hazardous material subcommittee of your EOC committee, that they send out a blank inventory or inventory from your materials management with a list of the chemicals that are on there, and then they can enter the quantity and that type of thing for that.
Thank you. And another question from an attendee. What is a good program or platform for maintenance tracking for PMs and work orders?
This is Dennis Smith. I'm going to defer that to Beth. She can certainly speak to that.
Right. I would encourage the person that asked that question to contact us at Dude Solutions, so we can walk you through what our core capabilities are, and hopefully they would meet your critical needs.
General question: what industry changes do you all see coming up in 2018 or 19?
Would you repeat that question, please?
Sure. What industry changes do you see coming up in 2018 or 19?
Troy, I'm gonna just jump in real quick. But for those of you on the call that attended the ASHE conference in Indianapolis this last year, we had a tremendous speaker, a futurist, talking about healthcare and the fact that we're really entering a time where there's a pretty capacity of hospital rooms per capita. So I don't know if it's going to be this year or next, but I think the pressure's on for all of us. Hospitals are going to change. I think you're going to see the number of beds in the communities become less and less. And I think the key to everybody on this call is you want to be one of the folks that is a survivor as this takes place, and that means a well-run and efficient operation.
Thank you. So go ahead.
go ahead, Beth.
No, that was Kathy.
No,
but
Troy, please, go ahead.
Okay. I'll be a little bit more specific in that I think that right now involving surveys is that Joint Commission hasn't really been that in-depth with the review of the emergency management programs. I think that that's going to change in 2018, and that there's going to be a little more focus on a little bit more in-depth focus on the emergency management programs because of the CMS requirements.
Thank you. Another question, what items do you typically find fall into the alternative maintenance plan?
This is Dennis. Typically, there'll be older pieces of equipment. You know, there are some air handlers out there that are quite old that still function, been maintained well, but the original manufacturer may be completely out of the question. But it's a piece of equipment that you have years' worth of operational data on if you've been collecting that in a good computerized maintenance system. And if you can demonstrate that equipment that is now outside of warranty or not on contract, like Troy spoke to earlier, it may be an older piece of equipment. If you've got good data that says you've been able to maintain it and keep it operational, then you can make, a qualified person can make a decision to change to an alternative equipment management system for a given piece of equipment.
Let's see, next question from one of our attendees. The EP that were referred to, are they all from the Joint Commission?
Yes.
Okay, thank you. And next, can I add time to the PMs so that at the end of the day I can review a man-hour report?
Yes, yes, you can. You know, again, you can have a stopwatch on task. Inevitably, someone's going to forget to stop the stopwatch, or some change is going to need to be made, and so you do want to have the flexibility that those times can be edited. So that's definitely a capability.
Thank you. We're trying to track another question down that popped up and disappeared, so sorry for the delay. In the meantime, can MSL be engaged to help set up a CMMS compliance program?
Yes.
Excellent. And I think I have a question here with some typos, so I'm going to try to interpret as best I can here. For a unit was being used for cleaning ultrasound equipment, a risk assessment had been completed that due to the closed system and how a chemical is shipped and handled, the eyewash station is not required. What are your thoughts?
This is Dennis. I think that the work has been done. I mean, if the organization has done a risk assessment, really what it boils down to is the folks in a department or the equipment users are the experts. And the fact that you can demonstrate that you've evaluated it, that the system and the hazards are low, I think you've done your job. Keep in mind, the PPE is the first line of defense, and an eye wash is for when everything else goes bad.
Thank you. And
yeah.
Go ahead.
Right, just a second. I'd like to add to that. Dennis made a good point, is that the lack of PPE does not mean that you need an eye wash. If you know, you still, when you're handling chemicals, you still need to have your PPE.
Thank you. Good addition. We have one last question to get in before we let people go, but could you expand on technology, the technology around managing emergency management procedures?
Absolutely. There's outstanding technology out there today where, we're faced with a number of scenarios in regards to emergency management. And typically, it's really hard to keep all the different scenarios in place. You can have them electronically instead of in a manual. It can be set up so that, based on the scenario, the appropriate personnel are being notified, and the whole process that you've scripted comes into play.
Thanks. And I want to sneak one more question in because it just came in. Living in the real world with fire alarm wires draping the sprinkler pipe, do you see that being changed at all?
This is Dennis Smith. My understanding is that there is potential to quantify what's allowable on a fire sprinkler line. But today, I have not seen any official notification from Joint Commission or CMS that would allow that. So today, if you have a strict inspector, one wire is too many. There may come a point in the future that CMS is going to have to make that determination as to what they would allow, how many ounces, or whatever criteria would be.
Thank you.
I agree with Dennis on that.
Perfect. Well, I so appreciate the panelists' time today to share the information in the slides and to answer these questions. We are going to wrap it up. So again, thanks to panelists, thanks for our attendees for giving us your time this afternoon, and I hope everyone has a great rest of their day.